Management of gingival tissues. Under this topic, the contents we are dealing with is the introduction, indications, methods, recent techniques, and conclusion. The various methods that we are dealing is physico-mechanical, like chemico-mechanical, chemical, rotary curettage, surgical, and electrosurgical. These are the 6 methods that we use to manage the soft tissue, that is gingival tissue. Moving on to the introduction. The teeth and their surrounding periodontal tissues, they are closely related. And the treatment of any one among this, that is the treatment of either the tooth or the periodontium, will affect each other. And hence, the cervical third that is highly sensitive, and any irritation to these cervical areas can cause the accumulation of the plaque and the calculus, and which affects the longevity of the tooth. So any treatment that's being done onto the teeth whose cervical area is being affected or whose periodontium is weak, then the longevity of the restoration will be a failure. So to obtain the best properties of the restorative material and to ensure the longevity of the restoration without adversely affecting the surrounding tissues, the management of the soft tissue, the management of the gingiva is quite important. And we also know that the sound periodontium is the foundation of a good restorative treatment. Indications. There are 6 indications. That is, there are 6 requirements for the need for managing the soft tissues. The first one is the subgingival extension of the margins. Second one, the control of the gingival hemorrhage. Then the aesthetics, enhancing retention and recording the preparatory margins during its impression. And finally, the removal of the gingival tissues. We'll be dealing each one in detail. The control of the gingival hemorrhage or the fluid flow. It's quite important because the cervical margin that is close to the gingiva can contaminate the restoration. That is, a proper isolation will not be obtained, and hence it affects the properties of the restorative material because of the lack of proper isolation, and hence the gingival retraction is quite necessary before moving on to a restorative procedure. Similar to that of the control of gingival hemorrhage, the control of the gingival clavicular fluid is also quite important. And in order to control the GCF, the gingival retraction is required. The second indication is the subgingival extension of the margins. The cavity margins that extend subgingivally. If the margins are extending subgingivally, that is the margins of the caries tooth or the cavity prepared, if it is extending subgingivally, then there are chances for the hemorrhage or the gingival clavicular fluid to sweep into the prepared cavity, which also affects the isolation of the cavity. And hence, the extended margins has to be properly isolated, for which the retraction of the soft tissue is important. The third is aesthetics. In case of the ceramic crowns, that's preferably given on the anterior tooth, the labial finish line should be 0.5 millimeter into the gingival sulcus. That is, the subgingival preparation is preferred because the margins of the crown should not be visible for the aesthetic concern of the patient, especially in case of the anterior tooth. Then the fourth indication is to enhance the retention of the restoration. This is mainly seen in case of the indirect restoration, that is, in case of inlays and onlays, that's cast restoration, etc., where there is tooth preparation as well as there is impression taking, that is indirect restoration. If the crown height is inadequate, then minor gingival surgery is necessary in order to increase the crown length. This is the same that is concerned with the retention of the restoration also, because in order to get proper retention, there should be adequate crown length. So to increase the crown length, the gingival surgery, there's a minor surgery should be undertaken for the longevity of the restoration. Recording of the preparatory margins during impression. This is also mainly concerned in anterior region, because we have extended the restorative margin or the prepared tooth margin subgingivally, then the recording of that margin should be perfect. For that, the retraction of the soft tissue has to be done. Then sixth indication is the removal of the gingival overgrowth. The gingival margins that are hypertrophied. In perio, last year you have studied that there are various conditions that is affecting the enlargement of the soft tissue. For example, in case of any drug-induced cases, there are hypertrophied gingiva. So for that condition, the removal of the overgrowth of gingiva has to be done. This is when it comes to the restorative procedure, when it affects the placement of the cavity margins or the placement of the restoration, then these enlarged gingiva or gingival margins has to be removed surgically. So what are our 6 indications? The subgingival extension of the margins during the cavity preparation, the control of the gingival hemorrhage as well as the GCF. In case of anterior tooth, the aesthetic is quite important, and also to enhance the retention of the restoration and indirect restoration, recording of the preparatory margins during impression taking, and finally the removal of the hypertrophied gingival tissues. Moving on to the methods, there are 6 methods. That is the methods to reduce the gingiva or to retract the gingiva. That is the methods for management of the gingival tissues. The 6 methods are physico-mechanical method, chemico-mechanical, chemical, rotary, surgical, and electrosurgical methods. The first one is the physico-mechanical method. In this, we mechanically displace the gingiva away from the tooth. For which we are using the rubber dam, wooden wedges, cotton rolled tools, and also we can use the retraction course. For this to be done, the gingiva should be normal and healthy. The physico-mechanical method using rubber dam, wooden wedge, cotton, and retraction cord can be done only if the gingiva is normal and healthy. We know that there are 5 types of rubber dam sheet, but for the retraction purpose, we use the heavy, extra heavy, and special heavy. What are the 5 types? Thin, medium, heavy, extra heavy, and special heavy. The thin is 0.15 millimeter, medium is 0.2, and heavy, extra heavy, special heavy, that is used for the retraction purposes. The heavy is 0.25, extra heavy is 0.3, and special heavy is 0.35. These 3 are used for the retraction of the gingiva. For extra retraction purpose, we can use the clamp 212. The cervical retainer means the rubber dam clamp. The number 212 cervical clamp can be used for extra retraction of the gingival tissues. It's not used in cases where the cervical extension is severe. The gingival cords or rolled cotton twirls can be introduced into the sulcus as the next technique, in which the isolation is against the GCF mainly, and this result is obtained only within 30 minutes. Wooden wedges that are placed interdentally means in between the teeth that depresses the in between the gingival tissues. In the plain retraction course that displaces the gingiva laterally from the tooth, and it is made from the ready-made cotton or synthetic fibers. These cords can either be braided or non-braided. The various size that we use is 000, 00, 0, 1, 2, and 3. The physico-mechanical methods, that is by using rubber dam, cotton twills, retraction cords, and wooden wedges. It is done only when the gingiva is healthy and there is only minimal gingival retraction is required, because this displaces the gingiva laterally and apically. The second technique is the chemico-mechanical method, that is by using chemicals. What are the chemicals that we are using? We use the vasoconstrictors, astringents, and tissue coagulants. Vasoconstrictants, astringents, and tissue coagulants. The astringents are otherwise called as the biologic fluid coagulants. of which the estrogens are more used when compared to that of the vasoconstrictors and tissue coagulants. These chemicals can be used along with the retraction code. Okay, vasoconstrictors, they are used along with the retraction code, and the commonly used one is the adrenaline and the noradrenaline. How do they act? They act by producing hemostasis and vasoconstriction. But they are contraindicated in cardiovascular disease patients and the patients having high BP and increased heart rate. Why? Because we are using adrenaline. That's the vasoconstrictor that we are using. Hence, it is contraindicated in systemic conditions such as CVS and in increased heart rate and elevated blood pressure. How do we use it? We use this along with the retraction code. The second one is the estrogen and the streptils. This includes the biologic fluid coagulants and tissue coagulants. They coagulate and the blood as well as the tissue fluids locally, and they create a surface layer that seals the blood and circular fluid. The various tissue coagulants are alum 100%, aluminium chloride 15 to 25%, ferric sulfate 15.5, tannic acid 15 to 25%. Their action is by coagulating the blood and the GCF, and they form an impervious layer. They are not contraindicated systemic condition cases, and they are commonly used for chemico-mechanical tissue retraction. The third one is the tissue coagulants. The chemicals that we use is zinc chloride 8% and silver nitrate. Their action is by coagulating the surface layer of the gingival epithelium as well as the least fluids, producing temporarily non-permeable film. They act as a barrier, but the disadvantage is that they causes ulceration, necrosis, and also change in the contour of the free gingiva. The retraction code has to be placed for 5 to 10 minutes, and the advantage is that they do not stick to the affected tissues. But the disadvantage is we require the code packer or the plastic filling instrument to insert the code into the surface, and the procedure is quite difficult. So just move on to the recap. What all we have dealt now? A small introduction and the 6 indications we have seen: the subgingival extension of the margins, the control of the gingival hemorrhage and GCF, the aesthetics, enhancing the retention, recording of the preparatory margins during the impression and removal of the gingival tissues. And the 6 methods we have just mentioned, of which 2 we have dealt with, the physico-mechanical and the chemico-mechanical methods. Then the other is the chemical, rotary, surgical and electrosurgical methods. Under physico-mechanical, we have seen 4 techniques, that's using rubber dam, wooden wedge, rolled cotton twirls and retraction codes. The rubber dam uses only 3 types of rubber dam sheet, that is heavy, extra heavy and special heavy. And for the extra retraction purpose, we uses the number 212 clamp. The rolled cotton twirls that can be mechanically packed using zinc oxide eugenol impregnated twirls, and that also helps in controlling the gingival tissues. And the retraction code can be used, which is chemically mixed, and the retraction code can either be braided or non-braided, and we have dealt with the various sizes of the retraction code. And second technique is the chemico-mechanical methods, of which we have seen 3 types, that is the vasoconstrictors, astringents and the tissue coagulants, of which the astringents are the most commonly used one. The vasoconstrictor is the adrenaline as well as the non-adrenaline, and also it is contraindicated in cardiovascular patients and the patients with high blood pressure and heart rate. Astringents we uses 4 types, that is alum, aluminium chloride, ferric sulfate and tannic acid. How do they act? They act by coagulating the blood and the GCF. Tissue coagulation, the 2 tissue coagulants are used, that is silver nitrate and 8% of zinc chloride. Moving on to the third technique, that is the chemical methods. in which we use caustic chemicals. The three caustic chemicals that we use are sulfuric acid, trichloroacetic acid, and negatol. Negatol is 45% methacrysol sulfonic acid plus formaldehyde. The commonly used or the currently used chemical is the trichloroacetic acid, which is a crystalline substance and it becomes liquid on exposure to air. Its action is for 1 minute and it produces the immediate hemostasis and hence it controls the gingival fluid. The healing is rapid without causing any inflammation and only minimal gingival retraction is required, which can be used especially in case of class 5, that cervical restorations. Fourth technique, that is a rotary curettage. It is also called as the gingitage. The minimal removal of the gingival epithelium can be done. That is by using the burrs. The main burr that we use for the reduction of the gingiva is the chamfer diamond burrs. And during the subgingival placement of the restorative margins, these burrs can be used for removal of the gingival epithelium. But as we know that when this burr removes the gingiva, it causes excessive bleeding and overextension. That is, when the healing occurs, it causes recession of the gingiva. The fifth technique is a surgical method. This is done with the help of a sharp knife and a conventional periodontal treatment is required for removing the interfering soft tissue. This is used in case when the gingival hypertrophy or excessive tooth fracture, that's extending subgingival. If more amount of the gingiva has to be removed, then we use the surgical technique using a sharp knife. Either in the case of a gingival hypertrophy or when the tooth fractures and the margins are extending subgingivally, the more amount of the gingiva has to be removed, for which the surgical method is being used. A temporary restoration has to be given for 2 weeks, otherwise there are chances for the regrowth of the gingiva back. The last technique is the electrosurgical method, in which the working area, there is no access to the working area and the conservative restoration cannot be done, then we use the electrosurgical method, or in case of gingival hypertrophy. The principle behind the electrosurgical method is using an alternating current at a high frequency, 60 to 120 to million or more per second. It's concentrated at tiny electrodes to perform various actions. The action is limited to 2 to 3 cell layers, but they are extremely high velocity passing through the body without inducing any shock. The 4 electrosurgical actions are cutting, coagulation, fulguration, and desiccation. Cutting, that is done precisely using minimum energy and they does not induce bleeding. Only minimal tissue can be removed using the cutting blade. The 4 actions are there. First one is the cutting action, in which only minimal bleeding and minimum amount of tissue is being removed. Second one is the coagulation, for which greater energy and the heat is being used and it causes a surface coagulation of the tissues. Third is the fulguration, in which a considerable amount of energy is used. A lot of heat is generated using this procedure, and the mechanism is carbonization of the tissue, and hence the deeper tissue involvement is being associated. The last one is the desiccation, in which the massive tissue destruction in depth and the width, and also there is uncontrolled in action. These are the 4 actions under electrosurgical method. What are they? Cutting, coagulation, fulguration, and desiccation. And the general rules for using these methods of management of the gingival tissues are: proper isolation has to be done, and the fully rectified current should be used in electrosurgical technique. And for cutting, we use a probe or a loop type electrode with light touch and rapid intermediate strokes is used. That is, the probe or the loop that we are using is not being contacted for a long time with the tissue that is to be removed, which causes the necrosis of the tissues. So we use only rapid and intermediate strokes. I repeat, the probe or the loop that we are using, that is the electrode that we are using for removal of the tissue, is not being contacted with the tissue for a long while, because It causes necrosis of the tissue, and hence we use only light touch and rapid intermediate strokes. Always cut the inner wall of the gingival sulcus to avoid the gingival crust and epithelial detachment. Avoid contacting with the metal fillings to prevent the short circuits, and the tips, the probe tip or the lobe tip has to be cleaned in between using alcohol. We'll go for a recap. We have dealt with 6 indications. What are they? The subgingival extension, the control of the gingival hemorrhage, aesthetics, to increase or to improve the retention, to enhance the preparatory margins, and to prevent the gingival overgrowth or hypertrophic gingiva. And the 6 methods that we dealt with is physico-mechanical method, chemico-mechanical method, chemical method of which the 3 chemicals that we use is sulfuric acid, trichloroacetic acid and negatol, of which only trichloroacetic acid is being currently used now. Then comes the rotary curettage, surgical method and electrosurgical method. Moving on to the recent advances, lasers are the recent advanced technique, and also some other techniques are also there. Will be dealing it. Laser, of which 3 types of laser is being used for the removal of the gingival tissue, excessive gingival tissue. That is carbon dioxide laser, ND-arc laser and argon laser. The lasers cause how the action is by photoablation, and the complete bloodless incision is being prepared. The tissue removal is being controlled, and it's a pain-free procedure. No LA is required, but the treatment is quite expensive. The 3 lasers that are mainly used are carbon dioxide, ND-arc and argon laser, and the action is by photoablation. It also provides a bloodless incision and a controlled tissue removal. In the retraction using by dilatation of the gingival sulcus, for which the gingiform technique is being used. Some modified silicone elastomer that is available as a base and a catalyst paste, and the base paste that is polydimethyl siloxane, and the catalyst is tin. On mixing, hydrogen gas is liberated within the silicone matrix that produces the foam. This foam expands the gingival sulcus, causing retraction. Gingiform technique is another advancement, recent advancement, of which the base paste and the catalyst paste are present. This reaction causes the enlargement of the gingival tissues, means widening of the separation of the gingival tissues. The base paste that is used is the polydimethyl siloxane, and the catalyst is tin. On mixing the base and the catalyst, hydrogen gas is produced, and this foam expands the gingival sulcus, causing the retraction of the gingival tissues. That's a pictorial representation. We have prepared the crown, and we can see the margins, but only when we retract the gingival tissues, we will get a proper impression, for which the base and the catalyst of the gingiform is being mixed, and it is applied onto the sulcus area, and the patient is asked to bite and maintain a pressure for 5 minutes. And after 5 minutes, when we remove the gingiform, we can see that the wide open sulcus. Thank you.